Hi, everyone. Thanks for joining me on drsue.ca. That's drsue.ca. Today, we're talking about the potential pros and cons of GLP-1 medication use before pregnancy. We know that it's important to optimize health and weight before pregnancy. The Obesity Canada Clinical Practice Guidelines recommend that women with obesity enter pregnancy at a lower BMI to reduce health risks to both mom and developing baby. GLP-1 medications like Ozempic, Wegovy, Mounjaro, Zepbound, Victoza, Saxenda, Trulicity are now in common use in women of reproductive age to improve weight and or to control blood sugars in diabetes. GLP medications need to be stopped 1 or 2 months before pregnancy attempts. The exact duration varies by medication per the product monographs because we don't have safety data on GLP-1 use in pregnancy, and weight loss during pregnancy is not recommended. Here's the conundrum. Every study ever done of any GLP medication tells us that weight is regained when GLP-1 medications are stopped. So, after stopping GLP medication to plan a pregnancy, weight is likely to go up before the woman gets pregnant and possibly during the pregnancy. We know that excessive weight gain during pregnancy is associated with health risks to mom and baby. So, with higher risks of health issues related to obesity before pregnancy and higher risk of health issues related to weight gain in pregnancy, does the balance rest in favor or against using GLP medication before pregnancy? The data on this question are conflicting. A recent study published in JAMA looked at 448 women in a database at one American center who had taken a GLP-1 between 3 years before and 90 days after getting pregnant, compared to about 1,300 matched women who hadn't taken a GLP-1 during that time frame. Women who had taken GLP-1s had about a 3 kilogram greater weight gain in pregnancy, over 30% higher risk of excessive weight gain in pregnancy, a slightly higher percentile baby birth weight, and a 34% higher risk of preterm delivery, as well as 30% higher risk of gestational diabetes and a 29% higher risk of high blood pressure disorders of pregnancy. But they didn't have a higher risk of small or large babies or C-section. One other study also found a higher risk of excessive weight gain in pregnancy in women who used GLP-1s up to a year before pregnancy versus those who had not, but this and another study found a lower risk of high blood pressure disorders of pregnancy. Other data have suggested a lower risk of gestational diabetes, preterm delivery, and C-section. So, an important limitation in the current data is that they compare women who haven't used GLP-1 to women of similar BMI who have, but we don't know the BMI or the health of the women before they started the GLP medication in the first place. In other words, these data are not capturing the health or weight benefits that the women have achieved with their GLP-1 use. So, what we need are data comparing women who used versus didn't use GLP-1 according to their BMI and health before the GLP-1 ever started. Sometimes women accidentally get pregnant while still taking GLP-1s. Reassuringly, no association between accidental use of GLP-1 around the time of pregnancy and birth defects has so far been found in humans. So, where does this leave women who are taking GLP-1s to optimize health before pregnancy? Well, given that weight and health benefits of GLP-1 start to regress when the GLP-1 is stopped, increased support and health surveillance, things like monitoring with clinical assessments and lab work for these women before and during pregnancy is going to be important. Where does this leave women who are thinking about taking GLP-1s to optimize health before pregnancy? Well, we don't know where the balance of health benefit, like improving weight and metabolic health, versus potential risk of weight gain and regression of health benefits after stopping treatment pans out. Included on the benefit side, some women with elevated weight and polycystic ovary syndrome may have infertility related to their PCOS and may improve their fertility with weight loss. As weight loss is really difficult for the vast majority of people to achieve with lifestyle changes alone, these women may need a weight loss medication to achieve improvements in their PCOS and weight to a place where they can get pregnant, though still needing to stop GLP-1s before pregnancy attempts, as I've already talked about. Bariatric surgery prior to pregnancy planning might be an appropriate option for a small minority of women, but this comes with its own host of planning, potential risks, and really close monitoring needs. And please see the link in my blog today on drsue.ca. In the Obesity Canada Clinical Practice Guidelines, there's lots of information on that. Bariatric surgery requires planning years in advance of family planning, and in most places has long wait times and really limited access. For women taking GLP-1 medications for diabetes control, other options exist for pre-pregnancy treatment like metformin and insulin, but these don't come with the holistic benefits of weight loss, and in fact, insulin promotes weight gain. So, the bottom line is that the decision to take GLP 1 medication prior to pregnancy attempts should be individualized and discussed thoroughly between the person and their doctor. Until we have better data comparing pregnancy health and outcomes in women who took GLP 1 medication before pregnancy versus those who did not, comparing their health and weight before the GLP 1 was started, we don't have clear information to tell us where the benefit, the balance, where the balance of health benefit versus risk pans out. Some women may need the help of weight management medication to help improve their PCOS in order to be able to get pregnant in the first place. GLP medications must be stopped prior to pregnancy attempts, as we don't have safety data in conception or pregnancy, and weight loss during pregnancy is not recommended. For any women who accidentally become pregnant on GLP medication, systematic collection of data on pregnancy and long-term outcomes is important. And a really important point, everyone, this blog is not intended for individualized medical advice. Make sure you're talking to your doctor to discuss your personal health situation. That's all for today. Thanks for joining me.